So I'm going to be talking about the reproductive differences amongst ISM, BSM, and heterosexual women. Lori already kind of touched on the fact that sexual minority women have unique health and reproductive concerns that are often not adequately addressed by healthcare providers. And this is typically demonstrated by differences in their sexual histories, rates of sexually transmitted infections, and experiences in conceiving pregnancies. And we can see this difference amongst bisexual women differently from heterosexual or lesbian women because they are less likely to disclose their sexual identity and history to healthcare professionals and less likely to receive frequent medical checkups. So because most of the current research is focused on women who have female partners or who identify as lesbians, our research aims to fill the gap in by looking at the experiences of invisible sexual minority women and their perinatal mental health. So as discussed, we recruited 96 eligible participants from Toronto and Massachusetts. This is 31 visible sexual minority women, 31 invisible sexual minority women, and 33 heterosexual women. And then these women were given a online first time point survey, which collected demographic information and reproductive history from the participants. So it focused on their sexual identity, history, mental health, experiences with healthcare providers, and the degree of outness to their family, friends, and communities if they were part of the sexual minority women group. And we found important differences between the ISMs and other women with regards to their reproductive history and mental health. ISMs reported more complex and difficult reproductive histories exhibited through higher fertility problems, terminated pregnancies, miscarriages, or pregnancy complications. Most significantly, 41.9% of the ISM participants had a history of miscarriage, compared to 23% of VSMs and 18% of heterosexual women. And this calls for more research into the particular health risks that ISMs may have and how it affects their reproduction or pregnancy. And as Corey discussed, ISMs also had higher depression scores compared to VSMs and heterosexual women, and this may be because of a higher likelihood of difficult reproductive histories, underemployment, and the invisibility of their identity. Our finding is consistent with other research showing that bisexual women have the poorest mental health outcomes, including during the perinatal period. And our findings suggest that healthcare providers should consider the unique health outcomes of this group in order to provide appropriate support.